This is the third and final video of Chapter 9, Section 9.3, Anatomy of Selected Diarthrosis. In this video, we'll be talking about the anatomy of the jaw, shoulder, elbow, knee, hip, and ankle. And we'll also talk about how the anatomical differences that we observe in these joints relate to their functions. So we're going to start with the temporal mandibular joint, TMJ for short, and we commonly call this the jaw. So the mandible articulates with the temporal bone, and this combines elements of three different types of joints. Okay, so this is in some ways a condylar joint, in some ways a hinge joint, and in some ways a plane joint. There is a synovial cavity of the TMJ, and it's divided into two chambers by an articular disc. There are two ligaments that support the TMJ. Okay, we have the lateral ligament and the sphenomandibular ligament. Interestingly, if we really open our mouth very wide, or if we yawn very deeply, the condyles can pop out of the fossa and slip forward, and essentially you can dislocate your own jaw by opening your mouth too wide. It's fairly easy to put back in place. If somebody, a dentist or a physician, presses down on the molar teeth while sliding the jaw backwards, the condyles will pop back onto the fossa. Okay, so we can take a look right here at what this looks like. So this is the region that we're looking at. So we have the, back here, the sphenomandibular ligaments, and in the front, the lateral ligament. This is the external acoustic meatus. So this is where the opening for your ear is. And the joint capsule is containing the synovial fluid there. And the articular disc we can see between the superior and the inferior joint cavities. TMJ syndrome is characterized by clicking in the jaw. So if you've ever notice that your jaw clicks, this is called TMJ syndrome. It affects a ton of people, 75 million people. A lot of times when we go to the dentist will check and see, is your jaw clicking? It can cause pain in your jaw and also down into your neck and shoulders and back if it's severe. Can cause pain in your face, headaches, sometimes even dizziness or ringing in the ears. This is caused by two things. First, tension and grinding your teeth or clenching your jaw, and also malocclusion or misalignment of your teeth. So if a person has TMJ syndrome and it's causing symptoms that are bothering them, ways that TMJ syndrome is treated include stress management, physical therapy, taking anti-inflammatory drugs or other mild painkillers, or doing something like braces to align the teeth properly. Okay, so now we're going to move on to the shoulder joint. The shoulder joint is called the glenohumeral joint or the humeroscapular joint. Okay, so we have a hemispherical, semicircular, semispherical head of the femur that's articulating with glenoid cavity on the scapula bone. So this is a freely mobile joint. Lots and lots of range of motion here. So glenoid cavity, socket part of the ball and socket joint, makes a loose shoulder joint capsule. Because it's so movable, it also has a little less stability than a lot of your other joints. Shoulder is supported by a tendon that connects the scapula to the biceps brachii. We also call these the rotator cuff tendons. So if somebody has damaged their rotator cuff, what they've done is they damaged the tendons that stabilize the shoulder. So we have 5 ligaments that support the shoulder. You guys don't need to memorize the name of the ligaments. We'll talk about them just briefly here. So there are 3 glenohumeral ligaments. There is 1 coracohumeral ligament and 1 transverse humeral ligament. We also have 4 bursa. Remember that a bursa is a sac of synovial fluid at the shoulder. Again, you don't need to memorize the names, but we do have 4 bursas here, and they're shown in this green color. So those reduce friction and allow the shoulder joint to move and be cushioned. Shoulder dislocation is a fairly serious injury, can be very painful, can cause reversible or permanent damage. A lot of times, if dislocation happens in the downward direction, that's the most common way for this to happen. Children have it happen more often than adults. Okay, so now we're going to move on to talking about the elbow. The elbow is a hinge joint. It has 2 articulations. Okay, so we have the humeroulnar joint and humeroradial joint. Okay, so in other words, there are 2 places where movement happens, where the humerus and ulna come together and where the humerus and radius come together. Okay, so these work always together in harmony. They take place in one joint capsule. They can't be separated. We can't move one joint without the other. Because we do have 2 separate bones articulating with the humerus, we do say there are 2 joints there. We have a bursa on the elbow that helps move these things and some ligaments that prevent the elbow from moving in any other direction other than that hinge. So the radioulnar works more as a pivot. And this one allows for the pronation and supination, that rotating where the radius and ulnar actually cross. Right, so now we're at the coxal or the hip joints. The head of the femur, that long bone in your thigh, articulates with the acetabulum of the hip bone. This is a weight-bearing ball and socket joint. This is different than your shoulder because your shoulder doesn't bear weight. We travel on our hands. Okay, so because the hip is a weight-bearing joint, the socket has to be deeper and much more stable than the shoulder. A lot more difficult to dislocate your hip. It's a lot less common to dislocate your hip. So we have some ligaments here that are very important. The iliofemoral and the pubofemoral are very important. So here's the pubofemoral, and here is the iliofemoral. Okay, and then we have the ischiofemoral, and that's on the posterior side. Okay, so these ligaments can move around each other, cross over each other, depending on the relative position of the hip and the femur. And we talked a minute ago, the dislocations are rare. That's because we have some cartilage in that socket that helps prevent dislocation. It is possible, for instance, to have a congenital disorder where their hips, because of essentially a birth defect, are able to dislocate because the acetabulum is too shallow. So the way to fix this is to keep femur and hip in the proper position for a few months at very early ages in order to get that positioning more correct. All right, so we're moving on to the knee joint now. We have the technical name for the knee joint, it's the tibiofemoral. We have the tibia coming into contact at a joint with the femur, so tibiofemoral. This is complex and larger than the other joints in the body. Okay, so typically it's a hinge joint, but it does have characteristics of some of the other joint types as well. Okay, it is able to do a small bit of rotation, and it's also able to do a small bit of gliding, but main function is as a hinge. There's a joint capsule, but it only encloses the lateral and posterior portions of the knee. Okay, so knee is stabilized by a quadricep tendon in the front, semimembranosus tendon that's at the back of the thigh, meniscus, and the lateral meniscus and the medial meniscus, and some C-shaped cartilages that are found inside of the joint capsule. There are some other ligaments on the posterior side, so the extracapsular ligaments and the intracapsular ligaments. The intracapsular ACL, you guys are probably familiar with hearing that. It is very commonly injured. Surrounding your knee are 13 individual bursa, or pockets of that fluid that help cushion and protect the knee and provide protection for the knee. You don't need to remember names of the bursa or specifically where they're located, but your knee does have many small bursa. Interestingly, your knee can lock and unlock, and this is important for humans to be able to walk upright. When the knee is extended straight, the thing that causes that locking mechanism is the ACL. And then when the ACL is disengaged, the knee can unlock. So our knee is really vulnerable to injury. Torn ACLs and damaged meniscus are two of the most common types of injuries. One of the reason these injuries heal so slowly is because there's not a lot of flow to all of those cartilage structures. Remember that cartilage is generally avascular. So knee injuries a lot of times are treated with arthroscopic procedures. And during an arthroscopic procedure, the joint is viewed with a very, very thin arthroscope, a type of viewing device, that's put into the knee through a small incision, and repairs are done through that small incision. And so there's a lot less tissue damage than in a conventional open surgery, which allows for a faster recovery time. Right, moving on to the ankle joint. So halocrural is your ankle. Okay, so this is like your elbow, two joints that work in harmony. So you have a place where your tibia and your talus come together, and then adjacent where your fibula and your talus come together. And like your elbow, we have one joint capsule here. And something that's interesting, because of the arrangement of the tibia and fibula overhanging the talus, your ankle can't move side to side. Your ankle has a lot of ability to move, but it can't move in that side-to-side motion. And because of this, the motion that you have available to you in your ankle is slightly less than in your wrist. So we have lots of ligaments that stabilize your ankle. Again, you guys don't need to memorize these specific names. They're very complex. If you are going into surgical or MD, PA route, you'll probably need to learn all these for right now, but know that there are a lot of them, and that sprains happen when we damage or tear ligaments and tendons. They can cause pain and swelling and limited mobility during the period that they're healing. So everybody's heard of arthritis. I am very confident. Arthritis is a very broad term, not particularly specific. Arthritis is generalized pain and or inflammation at joints. Because it's so common, it's the most common crippling disease in the United States, probably worldwide. Specialists who treat arthritis and other joint problems are called rheumatologists. When we say osteoarthritis, we sometimes abbreviate it OA. This is the wear and tear arthritis that most people end up getting as they get older. It happens as the cartilage starts to soften and disintegrate. We can observe cracking sounds when somebody stands up, their knees or their ankles crack. Bone spurs can also develop as a result of osteoarthritis. In contrast, rheumatoid arthritis is an autoimmune disease where your immune system attacks tissues in your joints. Okay, so antibodies can mistakenly attack the synovial membrane, and enzymes can then degrade the synovial fluid and cause the joint to begin to ossify. Okay, so ankylosis is the name for a fused immobile joint. And we can see some pretty severe deformities that can happen as a result of osteoarthritis. Treatments include steroids and aspirin. The steroids help to control the immune system attack, and aspirin controls inflammation. And finally, arthroplasty is when we replace a damaged or diseased joint with an artificial device called a prosthesis. You guys have heard of prosthesis. Okay, so we have some examples here. This is what it looks like after the procedure is complete. We can see the joint between the femur and the tibia here. This is a knee replacement. And this would be the head of a femur that's replaced.